Hey guys, Giles here. I wanted to just very briefly talk about motion palpation and palpation for diagnosis. Is it reliable? Are you feeling what you think you're feeling? And is it a valid tool for you to make a differential diagnosis as to whether you want to use like a manual therapy intervention, such as manipulation on a specific spinal area? Now, look, I'm going to cut to the chase here. I have a degree in osteopathy. I did it many years ago, and when I did my degree process, I basically thought I was like the Harry Potter of manual therapy, that I had like magic palpatory hands and that I could palpate someone's spine, I could palpate level by level, and I could feel the most minute rotations and lateral flexions, and that would give me my differential diagnosis in order to manipulate. But was I actually feeling what I thought I was feeling? Because now I've transitioned, we've published, and we're writing our fourth book. We've just submitted it to the publisher, and we have a whole chapter on this sort of misconception. And I think it's important we talk about it because 98% of manual therapists use motion palpation and palpation as a diagnostic tool to decide whether they're going to manipulate or mobilize or use a manual therapy intervention. 98% of us. Now, before you hate me, I'm not saying we forget our hands. Before you hate me and email me, these are still very important, and having good palpation skills, good soft touch, the ability to move the patient and work with the patient is incredibly important. But as a diagnostic tool, the research is not great, guys. The research is really poor. We looked at 44 journals for the chapter that we've written on motion palpation. 44 journals, and out of those, only 4 were decent enough to use. The rest were incredibly flawed with their methodology, really flawed. And some of the issues were about people couldn't agree, there was different experience, and ultimately the inter-rater reliability was pretty much no better than chance. So it was really difficult to actually find any really good evidence to show motion palpation and palpation as a good diagnostic tool. As an osteopath, we would look at Friart's law, the idea of sort of the vertebra being out of alignment and then subsequent movements to compensate that. But guys, Friart's law is over 100 years old. It was 1918 they did the first one of that. It's 100 years old. Is it relevant in 2019, 2020, when all the research is backing it up and saying, well, actually, you know, you're trying to palpate through skin, through tissue, you're trying to palpate joint position, and ultimately, for me to tell if a vertebra is like rotated and lateral flexed, I'd need to really work out where neutral is. And no one's neutral. In fact, everyone is wonkier than a freaking, I don't know, anything. We've all got some spinal movement and bits and pieces. This idea of a perfect spine doesn't really exist. So when I was palpating and going through these movements, what was I actually trying to diagnose? What was I actually trying to feel? Look, I'm not bagging it, right? Palpation is important, but guys, you've got to look at it from a sort of a quantitative approach, yeah? I would always say I would rather look at the quality and the quantity of movement. I want to see how the person's moving. Look at the quality and the quantity. Ask the patient, where does it hurt? Where's the problem? Show me yourself. Get them to do real-world movements, yeah? That will give you as good an idea as to the area of dysfunction that you want to use manual therapy on. And if you are going to use palpation, then statistically you have a better reliability of using pain provocation as an indicator of an area of dysfunction that you may want to use manipulation or mobilization on. Ultimately, if you push on an area and it's eliciting a painful response, then you have a better validity, a better area of sort of chance. That's the area you want to work on. So, like I said, I'm not saying palpation's crap. I'm not saying it's rubbish. I'm saying we have to step back and actually think, look, what are we actually feeling? And be realistic with ourselves and with our skills. Boom.